And joining us now, Dr. Leah Claire Bennett, Clinical Operations Director at Pine Grove Behavioral Health and Addiction Services. Dr. Bennett, thanks for coming on today.
Thank you.
All right, so May is Mental Health Awareness Month, and we wanted to have you on to help us understand. Let's start with what should we be looking for? It's probably unusual, I would think, these days that any of us don't have somebody within our orbit that probably needs some sort of treatment services. I think we've learned, it seems like, a lot more about the brain and mental health in general. We've called more attention to it, but we also have a lot more treatment options available. We just need to be aware and make sure we connect those people to those healthcare professionals that provide this treatment. I know your organization does that.
Yeah, so just making sure that people know the services that are available is really important. There are lots of levels of care for people to obtain and ways that people can do things first with themselves, looking at interventions and techniques for self-care and ways to improve personal mental health, but also when those things aren't working, not being afraid to reach out for other help, such as therapy, psychiatric services, or inpatient treatment when necessary.
Yeah, so, I've known situations, Dr. Bennett, where within a family members know that someone needs treatment, but they're hesitant to seek it, and they're hesitant to come forward. And in particular, the person who needs that treatment really is perhaps unwilling to receive it. These can be very sticky, thorny situations within families.
Oh, absolutely. And I think people that is part of the problem with mental health. That you hit the nail on the head when you said that people, I think, are more accepting of mental health, knowing that there's a genetic predisposition to it. But
Yeah.
we still have stigma where we avoid getting the help because of what we believe is true or what we believe people will think about us. And so those stigmas really get in the way of people actually reaching out and getting the help that they need.
How have the treatments evolved, Dr. Bennett, to where they are today? This is something that I got to believe we keep learning about, learning more from, uh, taking note of experiences, what practices seem to be the best and what works and doesn't. This has come a long way.
Absolutely. Evidence-based care for mental health is stellar. And for people struggling with anxiety or depression, usually shows that a combination of using medications along with therapy tends to be the most beneficial. And so when people are willing to and courageous enough to reach out and get those resources, they don't have to stay stuck in those symptoms of anxiety, depression, et cetera, so that they can get the help that they need.
Is there any particular mental health illness that seems to be more common than others that you've seen a lot of recently?
I mean, I think along with the pandemic, there's a lot of stress and anxiety that has definitely increased for the general population. I think as the pandemic is going down somewhat, we're seeing a decrease in anxiety. But in talking with providers across the country, I mean, people are still dealing with the impact of that increased and intense stress that we have all been under, and how that's impeded our abilities to cope effectively and to deal with stress. And I think that that's bled into a lot of areas of our life, such as the workplace, family, relationships with children, within the school system even. And so there's lots of ways that currently anxiety continues to plague many individuals in America.
So, would it be fair to say then that the workload of mental health professionals and patients that are seeking treatment has that increased as a result of the pandemic?
I think that there's definitely been an increase in different types of avenues of people getting treatment. So
Okay.
there are ways to access to do therapy sessions online, for example. There's lots of tools and apps out there. So I think that there's definitely an increase in people seeking these services as well as avenues in order to obtain the services.
I
I
see.
think people need to understand that, you know, it's okay to ask for help. It's okay to call and ask for help so that you don't have to continue to suffer in silence.
Yeah. All right. So, what about Pine Grove? How many patients can you accommodate at any point in time? Are there any patients that reside there, or that they just come in and seek outpatient type treatment?
Pine Grove is a really large facility. We actually have people coming from across the country to our
Wow.
residential or specialty level of programs. So we have chemical addiction treatment for both men and women. We have professionals, partial hospitalization treatment. We also have inpatient care where people come and stay for 5 to 7 days. Usually those are for medication stabilization. And then we also have outpatient services where those are
Mm,
just regular outpatient therapy sessions that people can come, 50-minute sessions or psychiatric appointments to get those needs met.
interesting. And what about the results? It's got to be rewarding when you see a person that is really struggling with their mental health, and then you guys treat them and utilize these best practices and get them stabilized and on their way and more productive.
Absolutely. It is something that is I've stayed here throughout my career because that's one of the joys of the work that we are able to do here is to see people whose lives were really in great distress and to
Yeah,
see them utilize the tools and the mechanisms of the things that they can learn here and really change and turn things around. And it doesn't just impact them personally, but it impacts the entire system that they go back to. So you see families' lives improved, which is just really exciting to know that they don't stay stuck.
yeah. Because within a family, it just seems like something like this, just anecdotally, situations I've been aware of, they're so disruptive to the entire family. It really becomes a burden on everybody who cares about the individual, and it's just difficult to function.
Right. And that's why, recognizing and helping individuals see that seeking care, there's nothing wrong with getting help. Just like you'd go to the doctor if you had the flu, go get help so that you don't have to have the impact. It doesn't have to, you don't have to stay stuck there and continue to hurt the people around you,
Yeah.
because it does have an impact on the whole system.
So, are there any particular or specific warning signs that we should be looking for? Any symptoms or just the way a person conducts their life that we should be aware of that says, maybe this is a mental health issue?
Yeah, I think when people withdraw from how they're able to typically lead their lives, like when you look at them and say, this seems really different, something must be wrong.
Yeah.
Usually we recognize those things, and oftentimes people struggle to have those conversations. They notice that something's wrong. They notice that the
Yeah.
person's not doing well or doesn't seem themselves. But instead of leaning into that conversation, they worry that they're going to hurt their feelings or
Yeah.
worry that they're going to make them mad. But usually if when that person's willing to have that conversation, it's a sign that they care in the relationship and they want to invest in the relationship. So being able to lean into those conversations, talk about it. I think also looking for signs like things such as irritability, increased sleeping, disengagement or isolation, increased worry to where they can't stop the worry about certain things. All of those would also be common signs, or increased substance use, where the
Yeah.
person used to, never have such a problem, but you notice more and more.
And so, yeah, I think your point was excellent that often we're hesitant when we see something and we're suspicious and we're just hesitant that we might offend a person or even it becomes confrontational with a person. Is there a particular approach that you would recommend of how to have that conversation, lean into it, as you say?
That's a great question. Absolutely. You don't want to go into it in an accusatory way, right? So you
Sure.
don't want to go and say, and you did this and you did that, and you're hurting the da 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 da. Da. Going
Yeah.
into it with the statement of I'm concerned about you. That
Yeah.
I want to see you do well. I want to see you happy. I want to see you functioning and doing the things that you enjoy. And I know that right now it doesn't seem that you're able to do that. And I want to support you in getting help. So I think sometimes people feel like they got to force it or they go
Yeah.
into it in a way that's very critical. And when we criticize, that just puts the person on the defensive.
Yeah. Exactly. That's excellent advice, and really appreciate that, Dr. Bennett. And appreciate you being on the program today and calling attention to this issue, as this is Mental Health Awareness Month. Dr. Leah Claire Bennett, Clinical Operations Director at Pine Grove Behavioral Health Services, Health and Addiction Services, has been our guest. We appreciate you coming on, Dr. Bennett.
Absolutely. Y'all, you have a great day.
You too. We'll step aside for a break right here on Middays. We're coming right back, though.